Hi, my name is Lauren Flores and I'm a grad student in the GPH 732 course. I'm going to be talking today about my final project, which is the Community Health Needs Assessment on my chosen community, Claremont. So just some background information. The information that I collected in this community-based health needs assessment was conducted within Claremont in the county of San Diego, California, between August 2017 and October 2017. Claremont is in the north central region of San Diego, California, and the north central region is just one of 6 regions located within San Diego County. For this community health needs assessment, the theoretical public health model that I used was MAP, and knowledge and conclusions made about this community were done using personal and visual observations, some windshielding surveys, and through interviewing 2 active key informants from the Claremont community. The use of secondary qualitative data and the analysis of this health data also aided in my findings of the health risk factors, socioeconomic risk factors, and behavioral risk factors that affect the priority health issue, which I chose to be type 2 diabetes. Discussed in this assessment are the at-risk populations most affected by type 2 diabetes, resources available in the community that prevent and treat diabetes, as well as the limitations that I found as a result of conducting this community health needs assessment, and some suggested solutions to the health issue. So just describing a little bit more about Claremont. It is one of the first cities in San Diego established after the World War II era, and a majority of the homes and businesses were developed in the early 1950s to late 1960s. It is near many neighboring towns, including Pacific Beach, La Jolla, University City, and Kearny Mesa. It's made up of about 13.5 square miles and contains many large transportation corridors like Claremont Mesa Boulevard, Claremont Drive, Genesee Avenue, and Balboa Avenue, which makes it pretty popular during peak traffic hours. Recently, there's been work with the Metropolitan Transit Development Board to connect service to the Mid-Coast Corridor, which can connect downtown San Diego area to the North Central region, and to busy activity centers like UC San Diego and Westfield Mall in University City. So this will hopefully bring some more availability to working and for personal use like going to school or shopping. And looking at health-related business and the business industry relating to health in the North Central region, it has 10 community clinics, 3 dialysis clinics, 2 surgical clinics, 39 HHAs, 11 hospitals, and 14 long-term care facilities. So it's a pretty big amount of healthcare facilities within a short area of space. So looking more at the methodology, I used the theoretical framework MAP, and I used it because it prioritizes public health issues and identifies resources to address issues within the Claremont community. So the community that I mentioned I'm focusing on is, of course, Claremont, and it is a majority low-income Caucasian and African American individuals. The demographics are 71.99% Caucasian, 4.2% African American, 14.4% Asian, and 9.2% Hispanic or Latino. The median age is 40, and for living situations, about 39% of the population rents and 61% owns their home. Some socioeconomic indicators after interviewing my key informants, they had mentioned lack of access to parks, recreation facilities, and safe sidewalks for walking, lack of access to quality of education, particularly breastfeeding and health education in new mothers, health rates of obesity in children ages 3 to 5, which we will be hitting more on in the next coming slides, vaping or smoking behaviors, and spread of hepatitis A. I used secondary qualitative data from San Diego County's North Central Region Community Health Needs Assessment, and there it mentioned that the four main health priorities or problems were cancer, type 2 diabetes, pulmonary disease, and injury. And out of those four, the main one that I will be focusing on for this community health needs assessment is type 2 diabetes. So the population groups that diabetes impacts the most are Caucasians, African Americans, males more so than females, and individuals 65 years of age and older. Here we see a graph from San Diego County and their diabetes brief. It shows both sex for male and female when it comes to diabetes, death rates, and then also by racial category, so white, black, Hispanic, or Asian Pacific Islander. As you can see, comparing male and female, male had a higher rate of death due to diabetes, and white and black had also the highest rates out of the racial categories for death related to diabetes. In this second graph by San Diego County Diabetes Brief, we can also see that the highest rate of deaths due to diabetes was in the age groups of 65 and older. Some information that I found as far as the risk factors and also available community resources. For risk factors, age definitely played a role. Family history of having diabetes, and then race and ethnicity as well. For social and behavioral risk factors, having pre-diabetes was definitely a risk for getting or developing type 2 diabetes. Having a poor diet, lack of physical activity or exercise, and obesity. And then the resource that really seemed to help San Diego County was the diabetes critical pathway developed by the County of San Diego and implemented through public health professionals, but it worked on improving health outcomes for those individuals who currently have diabetes, and then also focus on the prevention and early intervention opportunities that are available to stop the disease from developing altogether. Some summarizations of my findings. Socioeconomic factors, according to my key informants, were access to parks, recreation facilities, and safe sidewalks for walking, as well as quality of education, particularly breastfeeding and health education in new mothers. Income played a role, and education level. The demographic factors by the diabetes brief also stated that age, family history, race, and ethnicity played a huge role in the development of diabetes. And then the County of San Diego's North Central Region Community Health Needs Assessment also pointed out the four major health issues in Claremont, which were cancer, pulmonary disease, injury, and diabetes. And as you know, I focused on the health issue of diabetes. So here, I just wanted to compare diabetes prevalence in San Diego versus the U.S. overall. So as you can see, San Diego had 6.9% prevalence of type 2 diabetes, and the U.S. had a little bit higher at 9.1%. So you can see San Diego's below the national average for prevalence in type 2 diabetes. And here you can also see in this graph by the San Diego brief, San Diego County, the regions affected by diabetes broken down by each of the 6 counties. In black you see San Diego County as a whole, and then North Coastal, North Central at 12.7, so we're not the highest and we're not the lowest. We're on the lower end but not the lowest. Central, South, East, and North Inland. So just some last conclusions about this community health needs assessment. I still feel like city, county, state, and federal staff and partners are needed in addressing recommendations that will provide education and training to all stakeholders about the prevention and treatment of type 2 diabetes. And programs like San Diego County's Diabetes Critical Pathway proved to be helpful in reducing the risk of diabetes and aid in treating individuals who already have the disease. However, I feel like programs like this also need to be more readily available within the Claremont community in order to work towards combating this disease. And since type 2 diabetes statistically affects Caucasians, African Americans, males, and the age group of individuals 65 years and older, the programs created in treating type 2 diabetes should be mainly targeted towards providing aid and resources to these specific groups. Obesity often leads towards an individual developing type 2 diabetes. So because my community informants, Kim and Brenda, had mentioned that obesity is a leading cause and contraction of type 2 diabetes with preschool age children, I feel like obesity prevention and intervention should also be something that should be implemented within the public health system in Claremont, San Diego. But that's all of the information that I have for the Community Health Needs Assessment. I hope you enjoyed listening, and yeah, thank you. Here are my resources for this Community Health Needs Assessment as well.